Hello. Okay, so we got the script.
We're ready whenever you are.
We're live now.
Good afternoon. Welcome to the Black Health Trust. This is our weekly broadcast where we feature distinct physicians from across the country, providing credible information about health disparities and COVID-19. Today is a special day. We have a relationship with the National Medical Association, which is the collective conscience of African American physicians nationwide and even worldwide. And they are going to provide us today with their president, Dr. Leon McDougall, with an update on vaccines. We know that vaccines are here now, and our program is going to focus on what do we do now that we have vaccines and a number of questions about them. I'm going to ask my co-moderator, Dr. Barbara Nabert, in a moment to introduce all of the speakers and resource people that we have today. But first, I want to give the disclaimer. Even though we are physicians and medical practitioners, this show is not giving official advice for you medically. You must contact your individual provider physician if you want advice with respect to your health. The Black Health Trust is not a medical organization in that sense. We don't practice medicine, so we cannot provide you with official advice, even though it's very good that you listen to us and we'll only tell you the truth. So that is very important. To make this work, we've affiliated with a company called Biometrics Second Opinion Experts, which can be found at biometricsecondopinionexpert.com. And we are assembling a panel of credible experts that you can consult with for individual information. The reason is many of our people don't have access to primary care, don't have a physician that they trust, and we want to provide that service. And over the next a week or so, that panel will be ready and it will feature many of the people that you may hear from today. So thank you for tuning in. This would be a good show for you to send an email or a text to your friends or family to tune in and look at us and listen to the advice, non-medical of course, that you're going to get today from our speakers. I'd like Dr. Barbara Nabert, if she would, to introduce herself. And I'm going to let her introduce me since I can't read, and introduce our distinguished speakers and resource people today. Dr. Nabert.
Good afternoon, everyone, and thank you, Dr. Maxey. It is my pleasure to be with you this afternoon. This is a time of great seriousness. I don't know that we are at a crossroads or at a turning point, but we certainly have tremendous damage being done to our population, to our country, and we certainly are trying to do our part at Black Health Trust to convey credible information to our community. Black Health Trust was founded by Dr. Randall Maxey back in the early days of COVID, and it was born out of a concern that credible information was not being received by our community. The efforts that we have engaged in over the last several months has been dedicated to bringing you the nation's best and brightest minds that in most instances also happen to be African American, so that you can have some trust in the information that's being distributed. Dr. Maxey has had an esteemed career in medicine. He has joint degrees in pharmacology and medicine, and has subspecialized in diseases of the kidney and the cardiovascular system, with other interests being developed along the way as the need arose. He is known as a nephrology expert, not only in the continental United States, but in our territory, as well as internationally. I am a pediatrician by training and have been in several different phases of the medical field, which has given me an opportunity to develop a fairly broad perspective, which has come into great use as time has gone on. I'm currently a senior medical director for Magellan Health, which is a managed care company, and my area is specifically dealing with Medicaid and Medicare. We have several speakers this afternoon that are renowned in their fields. Many, if not most of them, have actually previously presented on one of our Sunday afternoon shows. But as we recognized at the very beginning of this process, the COVID story is an ever evolving story. So we have to continue to review the information because new information becomes available every single day. I had the opportunity to look at what I think was my first print article addressing COVID back in March, which seems like years ago and not just months ago. And the title of the article was An Emerging Viral Disease in China, COVID-19. Boy, has it ever emerged. This afternoon, we're going to have, as Dr. Maxey mentioned earlier, the current president of the National Medical Association, who is chair of the NMA COVID-19 task force. Now, we had previous members of the task force on a couple of months ago, who outlined the process that was being undertaken to review the information by the task force, so that we were not in a position of only taking the word of the FDA or even the CDC, that we would have our scientists review the information and give their interpretation of the information. So Dr. McDougall, who is at the Ohio State University, a family practice physician and a known authority in the academic circles around diversity and inclusion, who is going to share with us the progress of the task force. Now, as I just said a minute ago, this is an evolving story. So I by no means expect this to be the last visit from Dr. McDougall or other members of the task force, because there's still a lot of information yet to be forthcoming, and for which we will be looking to them for their expertise. We are also going to have this afternoon a celebrity guest. We're going to have Mr. Haywood Workman, who is an NBA referee. Mr. Workman has played on several teams, the Hawks, the Pacers, the Bucks, and the Raptors, as well as international league teams. And he has been honored as a Hall of Famer at ORU. And I'm sorry, I'm not sure which university ORU is. I'm sure he will clarify that for us, as well as honors in both the high school and college level playing. We will have also a return visit by Dr. Ivan Walks. Dr. Walks, if you may remember, for those of you who were with us a couple of weeks ago, or those who this is for your first time, I will share with you that he is a licensed psychiatrist and former chief health officer for the District of Columbia. He has served, like many of us, in many roles as the practitioner, as the teacher, as the advisor. Of note, and I hope most of you were here last week, he shared with us some very provoking comments, and I certainly anticipate that we will not be disappointed today as well. Another one of our, and I should say Dr. Walks is a new member of the BHT Medical Advisory Team and is serving as the chair of the BHT COVID Task Force, which is reviewing information and will be responsible for the formation of our forthcoming policy statements on the vaccine. Also with us today is Dr. Ann Stavron. Dr. Stavron has been with us before and is also on the Medical Advisory Board. She is a practicing geriatric psychiatrist. No. Somehow or another, I apologize, Dr. Stavron. The bio of someone else was transposed into the document that I have that's supposed to represent your bio. I know for a fact that Dr. Stavron is in California and has worked extensively in allergy and immunology. And I'm going to ask that Dr. Maxey fill us in on your background at this point. Dr. Maxey?
He's a pediatric immunologist, allergist of the highest caliber, and also well-spoken in the area of vaccines, former president of the Charles Drew Medical Society.
Thank you so much. And again, Dr. Stavron, I apologize for that. Next, I'd like to present Dr. Carolyn Tower. Dr. Tower is a practicing radiologist and has been on the BHT Medical Advisory Team as well. She is associated with Drew University and multiple community offices providing radiologic consultation and supervision. She has been honored in the past as an outstanding teacher of the year, and she is working on publishing a book to help patients to be more aware of their own healthcare and gives talks on healthcare at health fairs to educate people about their health. Health advocacy is something that we really have not done enough of, and hopefully through the work of BHT, we will empower our audience to be better advocates for their own health. Next is Dr. Wilbur Jordan, another member of the BHT Medical Advisory Team. Dr. Jordan is an internationally known expert on HIV and he's one of those people who has had his hands on or touched the lives of innumerable African-American physicians in this country. And I'd like to take this opportunity to honor and recognize Dr. Jordan for reaching back and bringing the younger ones along. We don't have enough of that activity going on because we don't have enough young physicians, and we need to mirror the activities that Dr. Jordan has demonstrated through the years in strengthening the minority workforce of the future. Next, we have Dr. Vladimir Berthoff, who is a director of the Division of Infectious Diseases and professor of medicine at Meharry Medical College. For those of you not in Nashville, I can tell you that Meharry Medical College has had a very prominent role in the managing and advising of the pandemic in the Nashville community. Dr. Berthold is going to be talking with us about his work and his perspective on what's going on now in terms of the current state of the vaccines. And then we have Dr. Jordan Despani, who is a PhD and is a virologist and will be sharing his expertise. And finally, we have a new member of the group, relatively new member of the group, Dr. Natalie Janine Daly-Garnes, who is has a degree in molecular biology and practices currently in Houston, Texas at Baylor in internal and pediatric infectious disease. So these are our speakers today. And with that, I turn it back over to Dr. Maxey.
Thank you very much, Dr. Barbara Stevens, Neighbor Stevens. I appreciate you very much. I want to get to our program, but first I just want to review our statistics for today. When we talked on November the 22nd, the total cases in the United States was 11,800. As we talk today, we're at 17 million cases. That's where we are today. I listened on the internet the other day, and I heard a gentleman, I guess that's what he is, who was claiming to represent African Americans, or what we call indigenous peoples in the world. And he was saying that African Americans should not take the vaccine. And he used a lot of big scientific words, a lot of neurochemistry, which he clearly did not understand what he was talking about, and telling people that if they took the vaccine, it would kill them. The reason we started the Black Health Trust is to put out credible information based upon science. And I want to discourage people from listening to some of this crap that's on the internet of people who know just enough to pronounce the word right, but don't understand the scientific, metabolic, pathophysiological context of what they're saying, and they're misleading people. So I'm here to denounce that kind of stuff going out to our people. I resent it very much so. Every other week, we have a meeting among our physicians and scientists on Wednesday nights, and that meeting is restricted to those of us who actually practice medicine. And we allow people to say what they think there, and then we'll vet it and find out what we believe is credible and scientific. But we don't allow that kind of talk on our Sunday meetings to our lay public. So we want to find a way to make sure we provide health and safety to our listening audience. We will only bring in front of you people that we believe are credible in the science. And it's important that we listen to the providers that we bring here. Dr. Leon McDougall is the president of the largest African-American health organization in the world, established in 1895 when the AMA would not let African-American physicians join the AMA. So good, we started our own. And we're very proud to have Dr. Leon McDougall, who did appoint the NMA Task Force on Vaccines to present us with an update. Dr. McDougall, the floor is yours.
Thank you very much, Dr. Maxey. Appreciate this opportunity. I'm going to share my screen here and pull up our presentation for today. I'll briefly provide an overview and just share some updates in regards to our vaccine and therapeutic task force. And briefly, we know about the cloud of political influence that really helped bring all of us to such great concern about decisions being made at the federal, the government level as it pertains to vaccines, as it pertains to hydroxychloroquine and other therapies being offered and as remedies for COVID-19. I know you all in this group has talked extensively about this, so I'm going to keep it moving. And with that being said, with the times we are in, it made me look back to Dr. Reverend Martin Luther King Jr. and his book entitled, Where Do We Go From Here, Chaos or Community? And Dr. King appropriately spoke to the pillars of the Black community that we are all leaning on now to help guide us through these challenging times. As you can see here, the Black church, the Black media, Black fraternities and sororities, and us, Black professional organizations, the Black Health Trust, the National Medical Association, the National Black Nurses Association, really helping to guide our community through these trying times. And in coalition building, this is an example of that, working with Reverend Jesse L. Jackson Sr. and the National Bar Association, and now the Black Coalition Against COVID. We've penned a love letter. You can find it online, and that involves collaboration between the historically Black medical schools, Morehouse, Meharry, Charles R. Drew, and Howard University, along with the National Black Nurses Association, the National Urban League, the Montague Cobb Health Institute, and blackdoctor.org. So we've been convening some events, town halls, garnering 240,000 views or so, speaking to the time that we find ourselves in today. So let me focus now. I'm going to turn my attention to our task force comprised of pediatric infectious disease specialists, adult infectious disease specialists, member of the National Pharmaceutical Association, our Black pharmacists, members of the advisory board for California on COVID-19, members of the advisory committee on immunization practices, and county health department officials. So I'm just going to cut to it, Dr. Maxey. So our task force reviewed the clinical data to look for differences in health outcomes that would place the Black community at higher risk from the vaccine. So for the past several months, we've been meeting with Pfizer, we've been meeting with Moderna, we've been meeting with AstraZeneca. In fact, we met with both Pfizer and Moderna Friday evening. And so we'll be releasing an official advisory statement tomorrow. Would like to provide some highlights for you here this afternoon. So for example, in regards to persons with chronic diseases that are controlled and stable, most folks will qualify for receipt of the vaccine. With that being said, we're recommending consultation with one's healthcare provider beforehand. Also, as I said to them, you know, we are the National Medical Association, so we ask about data regarding persons enrolled in clinical trials with sickle cell disease or sickle cell trait, and were informed that that data had not been analyzed by Pfizer or Moderna yet. However, a formal request for analysis has been submitted by the NMA COVID-19 task force. Also, I know Dr. Jordan is on our panel here today. We asked about persons with HIV because Black people are leading the country with new infections. So persons with controlled HIV, with CD4 counts of 340 or more, and undetectable viral load were enrolled in the clinical trials. With that being said, the data will be reported during or before the first quarter of 2021 with a biologics license application. And we also spoke to autoimmune disease. So persons with controlled autoimmune disease were enrolled in the trial. We were particularly concerned about this with systemic lupus erythematosus being most common in Black women. So with the data, what is showing so far is that persons with controlled autoimmune disease, there was not an increased risk observed in receiving the vaccine. And then I'll just speak to the concern about fertility. And in the reproductive toxicology studies, animals did not reveal increased risk to the fetus. And at this time, there are plans underway to expand the clinical trials to include enrollment of pregnant women. So stay tuned in that regard. And we also are advocating for and support the 2-year phase 4 aspect of monitoring with the clinical trial, and also the V-Safe program, where one uses text messages and smartphones to share side effects that one may have or symptoms one may have as it pertains to the vaccinations and the vaccine adverse event reporting system. We think those are all important measures as these vaccines are rolled out across the country, that we can have real-time feedback and be able to make adjustments from an advisory standpoint as needed for the country. And just want to end, Dr. Maxey, and just kind of stating in regards to the short-term symptoms that people may have that have an average of about 3 days after receiving the vaccine, and they may include a redness and pain at the injection site, fatigue, muscle aches and pains, and joint pain and headaches. Most of that we're thinking, or some of that is the body being in response to create antibodies to the messenger RNA vaccine, so that when one is confronted with a live vaccine, we are armored up. And we know that more than the vaccines thus far demonstrating more than 94% effectiveness in preventing the full-blown infection with COVID-19. So that's my concise, to the point presentation, Dr. Maxey, and thank you for allowing this time to focus on such an important topic. And I'll stop sharing my screen here.
Well, thank you so much. I'd like to put a couple of questions before you and the other members of the panel. But in terms of the opinion of the leaders of the National Medical Association, there's been a lot of data out here, some correct, some incorrect. What is the overall initial opinion of the NMA that there's efficacy in this vaccine? Should communities of color consider, with the appropriate advice, taking it? What is a larger view that our scientists and doctors at the NMA and its coalition of task force are taking at this point in time?
So good question. So our summary, the advisory summary for the COVID-19 task force, a more detailed report or statement will be published tomorrow. We are in support of the emergency use authorization provided by the FDA for the Pfizer vaccine, and we are in support of the FDA advisory committee in support of the Moderna vaccine, and as we're speaking now, the CDC Advisory Committee on Immunization Practices, they're meeting. So, and we have members of our task force part of that too. So I think it's key, though, Dr. Maxey, there are a lot of different chronic ailments out there, and helping to determine whether one is under control, people should be consulting with their healthcare professional. So I think I would like to emphasize that also.
One other question in that realm. Presuming for the sake of this discussion that this vaccine is efficacious, that it is potentially something that will save people from some of the ravages of the illness. From a public health and health equity standpoint, is it in the interest of communities of color to consider encouraging people to take this if all of those things turn out to be positive, and they're advised to do it?
And that is another excellent question, and how I would like to frame that. Our approach as a community and a nation should be holistic. The vaccine is one tool. Wearing a mask is another tool. Physical distancing is another aspect of this, not gathering in crowds. So the vaccine is important. It's also important for us to continue to have and exhibit actions that help prevent the spread of COVID, because as we said, well, 94% effective, so that, you know, maybe 5 to 10% of people still may contract COVID despite being vaccinated, and one needs 2 vaccinations, and typically about 7 days after the second vaccination, one has full immunity. And then when people speak to herd immunity, that's 75% of the population. So 75% of 330, 340 million people. So it's going to be a while before we get there. And with the focus now being on our frontline healthcare workers and also persons in nursing homes, I would say we should approach this holistically, Dr. Maxey.
Well, thank you so much. We have a panel of research physicians that I'd like to get to. I'd like to ask each of these physicians, when they talk, in respect to time and getting as many in as possible, that they limit their initial answers to 45 seconds to a minute or shorter, so we can do a good round table. So I would like to have Dr. Nabret introduce first Dr. Walks and Dr. Berthoff and the others while Dr. McDougall is here. They can ask the questions of him, or they can answer or ask some of the questions in general that we have circulated to our speakers. Dr. Nabert?
Thank you, Dr. Maxey. And before we start that, I do think there have been several questions in the chat box that are specific to Dr. McDougall that I think are really important. Dr. McDougall, someone wanted to know, what did the task force mean when they said controlled immunosuppression, controlled SLE and other immunocompromised individuals, when you made the statement about being well controlled?
So having an established, so it was talking about autoimmune disease, that
Yes,
particular
yes.
category of disease. Those persons were included in the COVID-19 clinical trials. So controlled, I would think that would be a definition based on one following with the recommended treatment and so forth as determined by that person and their provider. Persons who, so just as a category of immunocompromised, I don't think I was saying that, because even with HIV, persons had to have had undetectable viral load, CD4 counts greater than 340 for enrollment, and specifically for the Moderna trial. So I'm not saying, so people who are stable in their disease, I'm just speaking to who were not included in the clinical trial. And so hopefully that helps answer your question. That's why I think too, it's so important now that once one's turn comes up in regards to priority, if one has a chronic disease and receiving treatment, I think it's paramount that a discussion takes place with that person's healthcare professional. That's all I'm saying.
Okay, thank you. And we're going to ask Dr. Berthoff if he would like to make any comments on the report from the NMA task force at this time.
Is Dr. Berthoff unmuted?
So I was talking. You always have to remind yourself. Okay. So I was saying thank you to Dr. McDougall for the wonderful work that the NMA is doing under your leadership. I'm very proud of the work that the NMA is doing regarding the COVID-19 pandemic. And sorry, what was the question? Sorry.
The question was, did you have any specific questions or comments about the highlights of the recommendations that Dr. McDougall presented?
Oh, okay. One very, very important point that Dr. McDougall made is to work with Black community leaders. I cannot overemphasize this statement. You may have very good messages, but if the messenger is not trusted, your message is not going to go across. What we in this group, our task is to educate church leaders, other community leaders, teachers, how to convey the science to their followers. That's our job. So this is a very important piece that's missing in the current plan to distribute and administer the coronavirus. And it looks like the government is trying to catch up, because I see from time to time, they're trying to contact this person, that person. So this is just catch up work. But okay, but it's not too late to do that. So that's a very important point. And the other thing also, we have to tell people, we as scientists, that there is still a lot that we don't know about this vaccine. Those two vaccines that have been approved, there's still a lot of things that we don't know. And those clinical trials are ongoing. They are collecting data. As we know more, so we'll come back and present this data to the public in a transparent manner. For example, we don't have data in pregnant women. We don't have data in adolescents and children. We don't even know if this vaccine prevents transmission. The trial was designed with the primary endpoint coronavirus disease, not coronavirus transmission. And we know that people can get coronavirus twice. So it means that if you've been vaccinated against coronavirus, that does not prevent you from getting coronavirus. As you just said, you should still do all the usual, take all the usual precautions, wear a mask, practice social distancing, and so on. We don't know how long the protection that the vaccine confers will last. So far, the longest follow-up data to answer that question is a 90-day follow-up, which is very, very short. So that's from the Moderna trial. So once again, we need more data. I know that there are some incoming trials that they're going to look specifically at transmission. But right now, we don't have the data. Of course, the vaccine is a very important first step. It's a very important first step. The data is pretty solid, but the data is a 2 months data. It's a 2-month follow-up data. So we don't have long-term follow-up data. So I am personally concerned about the cases of severe allergic reactions that we've seen in just one day. So as we are upscaling vaccination, we may see more cases of severe allergic reactions. So having said that, one message that we have to send to healthcare centers, medical providers, if you plan to give the vaccine, make sure you have your kit ready for any case of anaphylaxis.
Thank you.
Thank you so much. I think you touched on some of the questions that actually were in the chat box. I'd like to turn the discussion now over to Dr. Walks. Dr. Walks, are there any comments or questions that you would have for Dr. McDougall?
Good afternoon, everyone. I've been listening. Dr. McDougall, I feel like I spent the day with you. We were on together with Reverend Jackson this morning. I would just like to encourage everyone to pay particular attention to a significant part, I think, of Dr. McDougall's presentation, which is that folks that we know and we respect, and he knows and he respects, have been a part of this process all the way through. There are absolutely questions that the NMA has appropriately posed to Moderna and to Pfizer. Of course, we need additional information, and we've asked those questions. But this is not something that we have not been paying attention to, that we have not been following. The National Medical Association has been following this. The NMA has had folks in this every step of the way. And my concern is that by waiting until every single question is answered and waiting until we have had these second trials looking at particular parts of the population, we're dying every day. There are people that look like us that are dying every day. And the last thing I want to say on this point is we really have to focus on what the real issues are, which are the different parts of our population, because it's not all one Black person or one person of color. There's a lot of different people with different kinds of health concerns, from lupus to whatever else people have. So we do need to make sure we're getting information that's relevant to the individual person. But we have to be able, at this point, I think we have enough information, particularly going back to the fact that we've been involved in this going through, people representing us have been involved in this going through. We can stop the conversation about, is this an experiment on us? Are they trying to do something bad to us? Are they really, is this another where, you know, medical trauma, medical cruelty, medical what have you? We know there are disparities, but I think we're far enough along now where we can tell people, get good information from your healthcare provider and know this is not Tuskegee Part 5. This is not where we are right now.
Thank you so much, Dr. Walks. Dr. McDougall, there were a couple of questions related to whether or not the NMA task force is looking at the issue of equitable distribution and access to the vaccines by our community.
Another very good question, and in fact, that is so for us. We also met with the FDA Commissioner Hahn and some of his leadership, including Brigadier General Arroyo, and speaking to that issue in regards to distribution, dissemination of the vaccine. I've had, so let me summarize this. As president of the National Medical Association and chair of our task force, within the past week and maybe a day, I've talked with Dr. Redfield from the Centers for Disease Control. I've talked to the director of the NIH, Dr. Francis Collins, and also Commissioner Hahn. That is on the table. And what I've said to them and continue to say it, when we look at the dissemination distribution plan, we see on the Centers for Disease Control website that we are dying at a rate 2.8 times that of more than European Americans. We are being hospitalized nearly 4 times that of European Americans. So we're advocating for whatever distribution dissemination plan is put forth. It should address that gap. It should be designed to close that gap. So yes, yes, this would be an answer to that question. We are addressing these concerns.
Thank you, Dr. McDougall. All right, I'd like to now give Dr. Ann Stavern an opportunity to make her comments and ask her questions. Dr. Stavern, are you there?
Yes. Good afternoon, everyone. I again want to thank everyone for joining, and I am very proud of all of us for kind of being in the vanguard and not behind in terms of this particular illness. I wanted to commend Dr. McDougall and NMA on their kind of methodical approach to this question. And I definitely agree with Dr. Walks in terms of the vaccine is here. Vaccines have been used to control viral illnesses for quite a long time. And we should realize our folks are dying disproportionately, and we should get them on board in terms of using one of the tools, as Dr. McDougall said, to prevent death and morbidity. What I wanted to say from an allergist point of view, an immunologist point of view, the concern about the allergic reaction. It's a fairly small number. Also, these patients had allergies. If I remember correctly, the first 2 patients had EpiPens. So I would caution, and I would use a little more caution than what I heard the CDC young woman. If you have allergic disease that has had anaphylaxis for any reason, not just vaccine, I would go to my primary care doctor or be referred to an allergist. This is not new to the allergist. We've gone through this with measles, influenza. We can test you before you get the vaccination to see if you have some allergic sensitivity. And then we can give you the vaccine in increments, observe you in the office. If you were at really high risk, we could probably desensitize you as we have for other things. So I agree 100%. We have to be ready for anaphylaxis. That means you must have epinephrine. And I want to repeat, the treatment for anaphylaxis is epinephrine, not just Benadryl. And because it can result in death, I strongly encourage you to make sure that you have some epinephrine and antihistamine on board if you're going to be given the vaccine. Overall, I'm quite pleased with regards to the 2 vaccines that are out. And don't forget, we have 3 more vaccines. And there may be a question of which one may be optimal for different groups. But we'll see about that. But again, I do commend the NMA, and I hope that all of us as physicians, we can work together and bring COVID under control. Thank you.
I have an impossible question, Dr. Stavern, and I'd like to ask of you and possibly Dr. Berthoff. I need a 30-second primer on what is an mRNA vaccine.
Now, 30 seconds. You want to take Vladimir? Essentially, they've taken messenger RNA that codes for the spike of the virus. They've given you that. The spike is made, and then you make antibodies against the spike, and that is what is causing the virus to essentially attach and get into your system and cause you to have the virus with significant morbidity or mortality. This is different than taking the virus either live, attenuated, or a killed vaccine, where you are now making antibodies against all the possible antigens that the viral molecule may present. So this is a very specific antibody response, and I think that's why it's fairly, very efficacious. It's against a very specific portion of the virus, and it is not the virus itself that's being introduced. And Vladimir, you can add on.
So what I would like to add to emphasize that the mRNA vaccine does not introduce any part of the vaccine into the host cell.
Right.
The mRNA is very fragile. To protect the mRNA against this fragility, it's incorporated into a nanoparticle, generally made of some lipid components. Once it encodes for the protein, the mRNA disintegrated very quickly. It does not enter into the nucleus, so it cannot change your genetic makeup. That's my 30 seconds.
Thank you so much. I want to introduce 2 gentlemen. This is so important that we have a learning session on the vaccine. In order to do that, though, it requires that we can do these broadcasts every week. And there is a number of challenges that we have keeping this on the air. So I want to introduce the chairman of our advisory committee, Mr. Carl Brooks, and then we have from the National Basketball Association, Mr. Haywood, and he's going to bring all the NBA players to give us some money to keep this broadcast on. So, Mr. Brooks, we'd like you to speak for a moment.
Good afternoon, everyone. We've done so many of these sessions that it feels like family on the phone. This is a good thing. This is absolutely a good thing. Happy holidays to everybody and their families, and let's be safe and don't let our guards down. We've come too far in order to get through this thing. We're going to do a Zoom nationwide Christmas Zoom with the family. We did it for Thanksgiving, and we're going to do it. We got family members in California and Georgia and all over the country. So we're going to do a Zoom, and we're going to do it safely. And we're going to talk about what we're grateful for and how much we love the family and our friends. So we're going to do that. And I'm encouraging others to do it. I want to ask another favor. Our final voting opportunity for this year is coming up soon, and it relates to the Georgia elections. My mother and father are both from Savannah, Georgia, so I got a lot of knowledge about Georgia, and there's been a lot of changes over the years. In fact, my first spanking came because I tried to drink out of the white water fountain. I thought it was lemonade in their water fountain, and I got spanked at a very early age trying to do that in Georgia, so things have changed. But we got to get out there and vote. One of my best friends, Thad Patterson, who lives in Atlanta, says that the race is too close to call on both sides. So we need to get out. We need to vote in record numbers as we've done in the past. When we talked last week, we talked about what the Black Health Trust is trying to do. And I'm in love with the fact that we're partnering with the National Medical Association, Dr. McDougall and his presentation, and working with this group of doctors, of which a lot of the Black Health Trust doctors have been NMA members for years and years and years. So we're working together as a group. Too often in our community, it's got to be one voice and one voice only, and this ain't that kind of situation. We need to take advantage of all the expertise with these great minds and do everything that we need to do. Last week on Wednesday, we had our first board meeting, and I talked with Dr. Randall Maxey, and we talked about it, and our theme was to be bright, be brief, and be gone. We didn't want to wear people out for hours and hours and hours. We need to run it like a corporate board that I'm familiar with, and we did it in an excellent way. And we came up with a board that's both medical professionals and other professionals. We got lawyers, Indian chiefs. We got some bad brothers and sisters on the board, and we're going to be working effectively with the NMA and others to get things done. We're struggling with having to, with all that's happening, the economic impact on the African-American community, we're struggling with donating to our causes. Anybody that's going to give us real money wants to find out, how are you helping yourself? They want to know, are you helping, are you contributing money on your own to this great cause? And I know from my ELC experience, and I used to say that the ELC brothers were the baddest brothers and sisters on the corporate planet, and they were, and they still are. But we had to show that we would help ourselves, and we donated and did things on our own before we got corporations to help us. We need to do the same thing with Black Health Trust. And our donations have been, I know the economy is bad. I know that people are out of work, but we're not asking for a specific amount. We're looking for indications of support so that we can show these fundraisers that we're doing the right things and we're not sitting and begging. We want help from others, but we're doing it for ourselves at the same time. So I'm encouraging you to push and support us, and any amount of money will be helpful. Our website is going to be improved immensely. We met with the presenter and the provider of our new website, and that's going to be coming out around the 8th of January, and it's going to be world class. It's going to be easy to look at any previous programs. You can go right back to the very beginning and look at all of our programs. You can donate. You can get information on bios of the various doctors, lawyers, and Indian chiefs that work with us. So it's going to be a very, very, very efficient website. But we need support. We need some administration. You know, as president and CEO of the Executive Leadership Council, I had 5 administrative people in addition to vice presidents and directors and all that. So I had all the administrative support I needed. We're struggling with that. We're doing it on a shoestring. We need more equipment and we need more administrative support so that we make sure everything you see on Sundays is world class. We don't want class B nothing. We want everything world class as we present to our audience. This is family, and it should be the best that we can provide. So I'm asking you to make donations on that and to help us with that. And the last thing I want to do is to ask you to be aware of a film that's out. My son graduated from Howard and Harvard, and he runs Sean Combs' company out in California. And he told me that I needed to see this film. There's a film that's called Between the World and Me. And it talks about the struggles of African Americans. And Camilla Forbes is the artistic director for the Apollo. She's also the director of this play. Let me say it again, Between the World and Me. And it's on HBO. And I just looked at it again 2 days ago. It's world class. Oprah Winfrey, all the actresses and Black actors and actresses are shown in this thing. It's absolutely great. They're already talking. Tony Coates is on there. He's part of that program also. So if you got time over these busy holidays, see the film Between the World and Me, and Camilla Forbes is the artistic director for that. And Chadwick Boseman and all of them are on this. This is an excellent, excellent view of our history and how tough it's been in America for African Americans to succeed. Thank you guys, and have a wonderful, wonderful, safe holiday. Love you all. You guys are part of the family now. Love you guys. Thank you.
Thank you very much, Carl. We have a special guest in that the National Basketball Association is represented here by one of their former players and now currently a referee. He's a guy who can snatch those big 7-foot guys around. Mr. Haywood Workman, we'd appreciate your comment on what you're doing with the NBA and how it's affected by COVID.
I want to say thank you, Dr. Maxey, for having me come aboard and listen to the doctors. I'm in the middle of the fight, the struggle, because I'm traveling from city to city. So with my coworkers, we're trying to find, what's the best way to travel? What's the best way to go about our jobs? Because we're testing every day and we're not always isolated. So to hear, what the doctors would suggest, I think would help. But I think as a whole is getting the information out for our community, because we are dying. And I think this platform that I'm on as a former NBA player and now the third ever NBA referee, it's some way that I can help in my community to get proper information out, and also seek those guys or the different unions in this corporation that could possibly help with you guys and ladies and doctors are doing. I just want to listen and learn for the most part. And I just had a few questions. I guess you've answered them, but from my perspective, I don't know. Couple of questions that were, which of the vaccines are better? If that's a question to ask. Would the side effects be different between the two vaccines? And the other one I had, because when I talked to my primary doctor, I know my vitamin D was low. So I would think that in our community, vitamin D, or it's low. So what is the optimum number with vitamin D? And these are some questions. I know that I'm a basketball. You probably yell at me because your team didn't win, but that's okay. It's all right. So, but I'm here just to listen and learn and to see if I can reach out to, the different unions from this corporation and get them and have them join this call and see how that they can help and how we can all get involved.
And we're going to answer your question. Would you give us just a couple of seconds on the dynamics of the basketball player living in the bubble? And are there any problems with that? Is it working?
Now, as of right now, I didn't participate in the bubble that was in Orlando. But now, because of the way they're going about this bubble, is we're testing every day. There's the PCR test, and then there's the rapid test. So we try to take the PCR test every day, and that kind of creates the bubble and determine if anybody tests positive or not. And once you do test positive, you would be quarantined in that city, in that hotel, particularly where you are at the time, until you have 2 negative tests. I haven't tested positive. I've taken the test every day since we've started December the 4th as referees. So every day that I'm on the road or outside of my home, I take the PCR test. And when I'm home, and then I take the rapid test every day.
Well, thank you so much, very much. Dr. McDougall, I did send you a note that the Black Health Trust would like to become a part of the coalition that we talked about with Reed and others, and we can talk about that later, but we're very much interested in that. Dr. Barbara? Dr. Neighbor Stevens? Okay, let's go to some of our other consultants. I think the next one I'd like to comment or ask questions or make a statement, Dr. Wilbur Jordan.
Can you hear me?
Yeah, we can now. Yes.
Okay, thank you. I came on late because it took me a half hour to get on. I don't know what was going on, but I was trying to get on 2 different computers and neither one was letting me on. So I'm glad I finally got on. Vladimir, who I know well, basically said most of what I wanted to say. So I think between him and Dr. Waltz, we've heard a good explanation. I hope we can do things to get our people to get tested. And that to me is where we need to be focusing. It's what we can do to get Black people to get tested and to stop running around thinking that this is going to kill us. If this is from China or Russia, I might agree, but these tests were made. And I think we have to understand a lot of this comes from HIV and Hep C in terms of learning really the mechanics of a virus. And because of that, and the late HIV meds, these things were already being done. So I think we have to understand that. And the thing I hope we can do now is get people to get tested. But I agree there should be, and I'm sure there are in most places where they're testing anaphylaxis kit and have the person wait around. Don't get the shot and leave and go home, but get it and wait around for at least a half hour to make sure you're okay. As with any other foreign protein, the number of people who are going to have any kind of severe reaction is very slim, but we cannot look at someone and tell who it is. So I think it's important for us to do that. I think what we need to be able to follow also is how long immunity lasts. We don't know that yet, and that's important. Whether this is a one-time thing or whether this virus is going to mutate just as the influenza does, and we may need another one or not. But I think we should be focusing on getting our people to get vaccinated and to be the first in line when it can be, rather than running away from it. This is not a Tuskegee. I spoke at Centennial some time ago, and the students were always hollering whether this was a Tuskegee. So I asked them, what was Tuskegee? And nobody knew. I said, so what are y'all talking about? Before you call things a Tuskegee, learn what Tuskegee is, because you really are insulting all of us when you say this could be a Tuskegee. We can't have a Tuskegee now because we do have an NMA. We have Black professionals, but we can have a different kind of Tuskegee if we don't participate. And I think too much of us is spending time devoted to why we are not going to do something rather than doing it. The data we see on the news is right. I mean, most of the ICUs in this city, they're all full. So there's no place to go right now if we were to get sick. So I think it's important for us to take the step to get the vaccination now as well. But I think we need to organize more so we can be a voice to our people better in the future, because I don't think this is the last time we'll see something like this in our lifetime. Thank you, sir.
Thank you very much, Dr.
I'm gonna give you $1,000 from my Oasis account. Not you, I mean to the organization.
Thank you very much.
I better not see you driving a new car. Okay.
No, we're gonna send you a T-shirt though.
I got so many T-shirts now. I can use them or give it to some school kid.
Dr. Barber, who are you gonna call on next? Is Dr. Barber muted? I'd like to have Dr. Tyler comment or ask a question. Hello?
Dr. Tower?
Hi, can you hear me?
Yes.
Okay, great. Hi. I wanted to make a correction about part of the introduction. I was formerly an associate professor at Drew UCLA in the School of Allied Health. And more importantly, I'm board certified in integrative holistic medicine. And that's where I come in with regard to the vaccine. First of all, I want to address the elephant in the room, which is the fear factor. And I don't know if you've heard of the acronym FEAR, standing for false evidence appearing real. And what I'm referring to is the PCR testing. And I'm kind of, I guess, disturbed that we have not addressed the validity of the PCR testing, which is the main testing, RT-PCR, which is the main testing that is done to detect the coronavirus. I won't go into detail now, but the tests are all over the place, and the genetic material that's found has to be amplified in order to detect it. So the tests vary in terms of the number of amplifications that are used to detect the virus. A very popular test that has been advocated by Drosten in the UK, in Germany, uses 45 cycles, which is considered far too sensitive to have any meaning. The CDC has recommended 33 cycles, but I've heard experts say that really you shouldn't use any more than 30 cycles, because the PCR test was never designed to distinguish between an acute infection and an inactive infection. So that's the first thing. And we're all quoting the numbers that we're hearing from the CDC and on CNN and MSNBC, but those numbers are referring to positive tests, not COVID-19 cases as they're reporting it. They're reporting them as cases. They are not COVID-19 cases, they are positive test results. Even in the Pfizer trial, they didn't mention what PCR testing they were using, what CT, which is cycle threshold, they were using. And I have real concerns about that, because that leads to a lot of false positives. Similarly, we have not discussed the reporting of the deaths from COVID. The CDC changed the guidelines on how you would report the primary cause of death in this era of COVID. So even if it was suspected, even if the patient did not have a positive test, you could put down COVID-19 as the primary cause of death. And it's not a simple task to determine the primary cause of death. So I think a lot of the deaths that are being attributed to COVID-19 are not due to COVID-19. Some of them had not even had COVID testing. And as an astute scientific body, I think that we should be digging into those facts and try to get to the bottom of that. And everyone seems to be overlooking that. And now we're here with a vaccine. Now,
may I ask you a question, and Dr. Berthoff a question? One of the people, I think it was Mr. Haywood Workman, asked a question about vitamin D.
Yes.
Answer that if you could. And I want to make sure we talk at a level that is a lay audience. Most of us don't know about the magnification of tests. And I'd also like to have Dr. Berthoff maybe, or Dr. Despani, address the magnification effect at a lay level. And
yes.
We talk about in our Wednesday night program, but could you address the vitamin D issue?
Okay, with regard to vitamin D, I actually read an article recently that said that we may be vastly underestimating the amount of vitamin D that we should be taking. It has been generally said that if you haven't been taking vitamin D, you can start out with 50,000 IUs weekly for 1 or 2 weeks, and then you could drop it down to 5,000 units a day. The most accurate way to determine how much vitamin D you should be taking is to get tested for your vitamin D level. And then you can tailor your doses from that. Now, the article that I read said that it's probably more on the scale of 8,000 IUs per day, but I'm not telling you to take 8,000 IUs per day. I'm telling you to talk with your doctor, look at your levels, and titrate your vitamin D dose according to your level. However, we know that the higher your vitamin D level, the more protection you have, not just specifically for COVID-19. You know, the labs generally go from about, 55, the average is around 55 to 60. It is even okay to go above 60. And we know that with prostate cancer, levels of 90 are actually more protective, and it's actually safe. It's safe up to 10,000 IUs per day, but I'm not saying take 10,000 IUs. I'm just telling you the range, but you can stick with the 5,000, going to 5,000 IUs per day, and then getting your levels measured.
Let me ask a question of Dr. Janine Daly Garnes, who is an epidemiologist in Texas. I'd like your comment on the discussion we've had so far, and any questions you might have for others, or Dr. McDougall or Dr. Garnes. Is Dr. Garnes on? Then let me ask that same question then of Dr. Despani. Dr. Jordan Despani is a PhD. He's a virologist. He's a pharmacologist and a young Turk. Dr. Despani.
Yeah, can you repeat the question again? Because I believe one thing is that we need to address regarding the RT PCR.
Well, I'd like you to address briefly at a lay level the PCR test, the testing that we're doing, and the issue of vaccines. You're free to comment.
Yeah, of course. Yeah. So basically, all reverse transcriptase polymerase chain reaction is that you're taking genetic material. In this case, the SARS coronavirus 2 is its genetic material is RNA. So you're taking that and you're making a DNA template of that. The reason why is because RNA is a very, I guess, an intermediate genetic element. And by making the DNA, you are creating a form that is longer lived. And then from there, you can then use that for subsequent tests without worrying about it disintegrating during your subsequent assays or research studies. Based off of my experience, typically in the laboratory, you usually do between like anywhere from 20 to 30 cycles. So Dr. Tower was on the money there. Yeah, and then the question that I wanted to address is with Mr. Haywood. He had asked which of the vaccines are better based off of what we have seen with the Moderna vaccine. That's about roughly 94% effective, and then the Pfizer vaccine is 95% effective. So for all intents and purposes, they're roughly equivalent in efficacy. But what you want to pay attention to is the thermal stability. When I say thermal stability, I just mean how do these vaccines react in response to temperature? And one thing that we know is that Moderna has been working on their lipid nanoparticle platform for far longer than BioNTech and Pfizer. So basically, Moderna has gotten it to the point where their lipid nanoparticle vehicle can actually be stored at minus 20 degrees Celsius. So that's the equivalent of minus 4 degrees Celsius, which is, I'm sorry, minus 4 degrees Fahrenheit, which is, what you would have in your, like refrigerator, really. So based off of that, you can actually take the Moderna vaccine and then you can have it at even room temp, and then use that for up to 30 days before it's the vehicle begins to go bad. Whereas the problem with Pfizer's vaccine is that it has to be stored at minus 70 degrees Celsius, which if I'm not mistaken is somewhere like minus 193 degrees Fahrenheit. And because of that, one of the biggest fears that we have is that in getting these vaccines logistically across the United States, the fear could very well be that the Pfizer vaccine might thaw while it's being transported, and then the mRNA vaccine will actually like break apart, and you might be getting a shot that is not working. So really, what you probably should do is, again, if you can get a vaccine, it would probably be the Moderna vaccine. But again, if you only have access to the Pfizer vaccine, go ahead and do that. But keep in mind that the first people getting these vaccines will be the essential workers. And probably for most people, we expect that it will probably be those with pre-existing conditions that will likely receive the vaccines probably at earliest February. And most, I guess, the rest of the population that's healthy probably won't get the vaccine until probably like the earliest May, probably latest summer. So, but yeah, it's really thermal stability is the only difference.
Okay, before I go back to Dr. McDougall for some further comments and questions, I want to recognize Dr. Natalie Janine Daly-Garnes, who's an epidemiologist in Texas. Dr. Garnes, would you care to comment on some of the issues we've been discussing and how you view these vaccines right now? Can we make sure she's unmuted? I can see her.
Can you hear me now?
Yes.
Can you hear me now?
Yes,
okay.
Thank you.
All right. So in terms of my thoughts on the vaccines, or just my thoughts in general, first I want to thank Dr. McDougall and the work that the NMA is doing. I think it's very vital in acknowledging that the inequity that we've seen with the way this pandemic has come out and really working to try to address that inequity as we come up with solutions. And I also want to thank Dr. Maxey for inviting me to be on the panel today. And I had one correction with regard to my affiliations. So I'm currently practicing in adult and pediatric infectious diseases, but I'm not currently affiliated with Baylor. In terms of the vaccines, so going back to what Dr. Despani was saying, both vaccines are very similar in terms of the technology that they use. And so in terms of one being better than the other, there have been no head-to-head comparisons at this point. And so, what we have are the numbers that have been put forth at this time, and they're very similar. And, the error around the numbers that have been advocated for both of these vaccines are very similar. So there's no evidence that we have right now that one is better than the other. There are some studies that have been done, like for example, with the Moderna vaccine, they've already done some preliminary evaluation of whether their vaccine will affect transmission and not just disease, although what the FDA required for the EUA was just to show an effect on COVID disease. And I'm sure that Pfizer and the other companies that are working on vaccines will attempt to address that as well. But in terms of really getting the vaccine out there so that we can start making a dent in this pandemic, the goal is really to see the effect on disease. And so the goal of the vaccine right now, based on that information, is to decrease the likelihood of you getting either symptomatic disease or getting severe disease that requires you to be hospitalized or more severe. In terms of, there was a question in the chat about vaccine effectiveness. And I'm not going to quote the exact numbers because I don't want to tell you the wrong numbers. But in essence, the way vaccine effectiveness is calculated is by looking at, you have a group that got placebo, so they didn't get vaccine, and you have the group that got the vaccine, and you look at the number of people in each group that developed COVID symptoms. And so there were 95 to 94% more people in a group that got placebo that got COVID symptoms and were documented to have COVID infection compared to those that got the vaccine. And so that's where the numbers that they're quoting for vaccine effectiveness are coming from. It's already been stated that the vaccine does not incorporate into your DNA. It doesn't even enter the cell's nucleus. So it can have no effect on your DNA. In terms of safety in children, because as I said, I'm a pediatric infectious disease specialist as well. There were children ages 16 to 17 that were included in the studies for the Pfizer vaccine. It was 18 and up only, as Dr. McDougall mentioned, for the Moderna vaccine. So, teenagers who fall into a group that is prioritized to receive vaccine right now could receive it. The companies are looking into doing studies in children in the future. And one other thing, I guess two other things, in terms of monitoring after giving the vaccine, most of the places that are giving it are making sure that they monitor the people that they give it to for 15 to 30 minutes. And it is required that you have access to treat anaphylaxis during that period of time, should it occur. And then with regard to autoimmune disease, at least from the studies that I've seen, they have not further delineated which autoimmune diseases were specifically mentioned. I definitely reiterate, you want to discuss with your healthcare provider if they would recommend that you receive the vaccine. But one way that it was put, it was stable if you've been on the same medication dose for at least 6 months without needing escalation or without being hospitalized. Or if say you have the diagnosis of lupus, for example, but you're not currently requiring immunosuppressive medication. Thank you.
Thank you very, very much. I will also note she's related to one of our astute past presidents, Dr. L. Natalie Carroll. Dr. McDougall, I want you to comment again, but I want to recognize for a 1-minute comment one of our other esteemed past presidents, Dr. Richard Williams, for a comment, and then go to you, Dr. Williams.
Hello, can everybody hear me?
Yes.
Well, first, I wanted to congratulate Dr. Maxey on carrying on this wonderful dialogue, which has been going on for several months now, and to encourage contributions to the effort, which is going to be the kind of lifeline for continuation. And also to congratulate Dr. McDougall on an outstanding presentation, giving us the facts and bringing us up to date on what the task force is doing. And that task force of the NMA is particularly important because that's our task force. That's for our people. And that has to be recognized. One size does not fit all. And so all the recommendations that are being made across the board are not necessarily good for everyone. I just wanted to mention one thing in particular, and that is that in answering questions that people are posing about the vaccine, one of the questions that I've heard is whether the vaccine can give you the COVID-19. And I think that people need to understand that that is not possible, but they don't understand it enough. And so that needs to be emphasized. People have a fear, as was emphasized, about not only COVID-19, but the vaccine. And I will finally end by saying that in regards to answering the questions that people might have about whether they should take the vaccine or run the risk of getting COVID-19, I would suggest that a little bit of your mother's common sense should apply here. What's worse in people's minds? Is it a worse thing to risk a complication from the vaccine or to risk dying from COVID-19? And the answer ought to be clear to most people. That's what it comes down to. And people need to have that kind of thing addressed to them, people at the lay level. So thank you very much, Dr. Maxey, for what you do, and Dr. Leon McDougall for what you're doing. And I thank you for giving me the opportunity to address you all.
There are two books that Dr. Williams is the author of. One is called Black-Related Diseases, which is now in the African American Museum, and a more recent book called Black Doctors, featuring yours truly.
Blacks in Medicine.
Blacks in Medicine, featuring yours truly. At any rate, it's a book that we want people to look at. We want you to have faith and knowledge of the depth and breadth of the experience of Black physicians in the United States. Dr. McDougall, any further comments or questions you may have? And Dr. Nabrit, do we have any?
Yeah, I think, because I'm looking at the chat, and all questions are good questions, and there's some proposals about hydroxychloroquine being a treatment for COVID-19. And as you know, earlier in this year, the Food and Drug Administration approved hydroxychloroquine for emergency use authorization. It was touted as a remedy under a cloud of political influence. And not too long afterwards, the FDA revoked, let me say this again, revoked hydroxychloroquine as a treatment for COVID-19 because of adverse cardiac events. So, and then that kind of speaks to another issue that was brought up about a number of various theories one may see on the internet, well-produced videos. And I think Dr. Maxey, you spoke to this earlier. Some of these videos are professionally done. And unless you go into medical school or have a biomedical science career or background, it's hard to decipher truth from fiction. So that's what makes the Black Health Trust so important. So you're hearing from us here in person now. So that would be my statement.
Well, thank you so much for that. Dr. Barber, any other questions we should bring up in the chat box?
I think to a greater or lesser degree, we've touched on everything except one, and that was a question, and this is something that's burning up the social media these days, and that's the issue of Bell's palsy, whether or not it is being caused by the vaccines. And I was wondering if one of our panelists would like to explain the difference between causation and observation.
Very good. So Bell's palsy has been seen in some of the clinical trials. And when you compare the numbers expected in the normal population to develop Bell's palsy as compared to what's actually seen in the study, what's seen in these studies are less frequently occurring. And the symptoms are transient for Bell's palsy. For Moderna, the persons who developed Bell's palsy, one was in the placebo, that was an Asian person, and four in the treatment group, and they were European American. That being said, out of the thousands of people being treated in the clinical trial, when one does the calculation in regards to what's expected in the population versus what was seen during the clinical trial, is less than what would be anticipated. So I like the way you frame that question, Dr. Nabrit Stevens.
That does it, Dr. Maxey, for the bulk of the questions. There was an earlier question about when this program recording will be available, and it will be posted to the website within the next 24 hours.
That is correct. There are some other questions that we had earlier, and one was posed by Dr. Helen Davis, who actually sent me references. Is Dr. Helen Davis on? If not, her questions was, she had taken a vaccine for another potential condition, and her job wanted her to then get the COVID-19 vaccine. So the Pfizer answered back that there haven't been any studies on that. So they're recommending that if you take the Pfizer vaccine or any other vaccine, that you not take any concurrent vaccines within a 14-day period. Those are something very good. We all want to take flu vaccine, but the recommendations are that they should be separated by 2 weeks. Any ID people or epidemiology people have any comments on that?
Yes, the recommendation is what you just said, to separate the flu vaccine by 14 days. And one more thing I would like to add, people who had coronavirus, they can get the vaccine as well. It's not it's not recommended to get tested for coronavirus or for antibody before getting the vaccine. And the main reason for this, because the immunity that you acquired from natural infection or from anything else like monoclonal antibody is usually less than that conferred by the vaccine. So when you receive the vaccine, it's like a booster.
Very good. So I want to move toward the end of the program, and I want to make several observations. I was quite disturbed when I received and looked at some of the videos that are posted on the internet that, in my opinion, are basically trying to get communities of color to be confused or maybe not avail themselves of potentially life-saving treatment. And I happened to get my doctorate in pharmacology and neurochemistry, and there was this guy citing all sorts of interrelationships with acetylcholine and norepinephrine and all kind of other stuff. And he had just enough fact in there in terms of how he pronounced the words, but mixed with a lot of ignorance, that we need to make sure that we don't get ourselves confused. And he was suggesting that there was a group of people that are called indigenous and that they're Black. Well, in the year 2020, I doubt if there are very many people, especially in the United States of America, are pure any group. We've had so much miscegenation and interracial mixing that it would be extremely hard to find somebody that's a pure African, pure Jamaican, or what. So I believe that that's not even nearly fact at all. But we do know that this virus is a fact, it is real, it's affecting African Americans, if that's what we are, and communities of color, as Dr. McDougall says, 2.8 times more than other communities, and we need to avail ourselves of the best way we can protect ourselves to do that. We know that our physicians and our scientists have been at the table, not on the table, and they're involved every step in the production of these vaccines. And we want to provide encouragement that you seek your personal physician or healthcare person to advise you on this. I'm telling you, I advise you to take it. I'm going to take it. I tell people I'm 100 years old, I'm going to take this. I'm going to protect myself. But I'm going to go to the Black Health Trust recommended group which is biometrics.secondopinionexpert.com. And I'm going to have one of these experts, as you've seen today, look at my data and advise me if it's safe for me, and I urge you to do the same. We like to thank all of these physicians and scientists for being with us today. Dr. McDougall from the National Medical Association, Dr. Despani, who's a young virologist, Dr. Janine Daly Garnes, an epidemiologist, Dr. Barbara Stevens-Nabert, a pediatrics doctor, Dr. Wilbur Jordan, an infectious disease physician, Dr. Berthoff, who's chief of infectious disease at Meharry Medical School, Dr. Ivan Walks, a psychiatrist, former chief of public health in Washington, D.C., and I don't think I left anybody out of that, and Dr. Richard Williams, past president of the NMA, Dr. Carolyn Tower, expert in functional medicine, and all of the other people who took the time to help us with this program. I thank you so much. We'll be here same time, maybe for a shorter program next week, and every Sunday we will try to give this information out to help people. Any final questions, Dr. Nabert?
Well, I want to add to what I said about the website. You can immediately see the replay of this program on YouTube, as well as Facebook, YouTube and Facebook, immediately after this program.
And thank you. And for any of the physicians and scientists who are on the phone or on the call, I would like to hear from you if you're interested in being a part of the Second Opinion Expert website and become a consultant for some of our community patients. Thank you so much. Have a good day.